Hello and welcome everyone. I am Dolores White and I have the pleasure of serving as the president for the KNA. Thank you all for attending the KNA Town Hall tonight and to the Bluegrass chapter for holding this event. Thank you to the Governmental Affairs Cabinet for planning and holding the town halls this month across the state. And thank you to the KNA staff. Delaware and Kim are both here tonight and also participating in the planning and implementation of the town halls. So thank you. And a special thank you to all of the legislators and legislative candidates here tonight. We truly appreciate you attending and for your support. The KNA represents and speaks for 90,000 voting Kentucky nurses who make up 53.3% of the healthcare workforce. And we want to encourage you to please contact us at any time. If you need information or assistance, we would be happy to serve you as a resource when you have health and healthcare questions as you are planning legislative actions. We are here for you and we'll be happy to assist. Now I would like to introduce our KNA CEO, Delano Manson, who will review the agenda and guidelines for the evening.
Welcome, everyone. Welcome to the panelists as well as to the attendees. And as I said earlier, this has had the most registrants of all the town halls. This is the fourth and last town hall for this season. And thank you very much for being with us. I am going to say that we only have the two of you to speak, then you can speak for a really long time. Normally, we say 2 minutes for each question, and then also 2 minutes to introduce yourself and your priorities. So I have my little pen that I probably won't have to use today. And the little pen it gives you 15 seconds, and then I respectfully turn off your mic. We're going to do introductions, and then Linda Robinson, who is a co-chair of our Governmental Affairs Cabinet, will tell you a little bit about the KNA. And then the rest of the time, Julie and Linda will ask questions of the candidates. And then at the end, we will have a little review of what's going on with the KNA so that everyone is aware of where we are in our trajectory to get things done for Kentucky nurses. Okay, so let's do introductions for the two of you that are here, and then for the rest of us who are here who are staff and moderators. I'm going to start with you, Kim.
Hi, everyone. I'm Kim Becker with the Kentucky Nurses Association. I'm the Associate Administrator. Full transparency, I am not a nurse, so I enjoy working for and with the nurses of Kentucky and the great and wonderful Delano Manson as our CEO. So we are glad you're all here, and we know that these meetings have been so informative, so we're glad you're here.
Thank you, Kim. Kiana.
Good evening, everyone. My name is Kiana Fields, and I am running for Kentucky State Senate in District 17. So that is all of Scott County, Grant County, and parts of Southern Kenton County and the northwest part of Fayette County. So I was born and raised here in Scott County, and I have had the blessing to be an educator in the post-secondary level for almost a decade now. And so I look forward to talking with you all a little bit more about my intersection of healthcare as well as education. Healthcare and education are two of my top priorities just from my experiences as an educator in the post-secondary level. And I firmly believe that serving the people of the Commonwealth is something that I'm incredibly passionate about. And I look forward to chatting and allowing you all to get to know me a little bit more.
Thank you. Dolores.
As I mentioned earlier, I am the president of the Kentucky Nurses Association and have been honored to serve in that role for the past just about 2 years. Professionally, I work at Northern Kentucky University. I'm an associate professor in the graduate nursing program, so I work with students pursuing their doctorate. Welcome again.
Thank you, Dolores. Linda.
Hi, my name is Linda Robinson. I am the co-chair of the Government Affairs Cabinet for the Kentucky Nurses Association. I've been a nurse for over 30 years, and I currently am the Executive Clinical Excellence Consultant for MDM Healthcare, and I work with bringing technology and innovations and transformations to hospitals across the United States. Thank you all for being here.
Thank you, Linda. Julie.
I'm Julie Denton. I'm the contract lobbyist for the KNA, and I'm not a nurse, but I am Dr. Mom at my house. That's the closest I'm going to get.
Daniel.
Yes, I'm Dan Pfister. I am the state representative in the 56th district. That is all of Woodford County, geographically about half of Franklin County, and then a portion of Jessamine County. I'm here tonight just to listen and to find out what your all's needs are. I am not a medical professional. Closest thing I come to it is as a customer, a patient occasionally. And my mother was a nurse. I mean, there's nurses in my family. I truly value you all, but that's part of why I guess I'm here to listen and find out what your all's needs are. Thank you.
Thank you. Is that you, Sherry? Well,
Thank you.
introduce yourself.
Hi, I am Sherry Chandler, Membership Manager, and I love coming to these town halls. They're so informative. So thank you all for being here.
Thank you, Sherry. Okay, so we're going to go ahead and get started. Linda, would you talk to our attendees and our panelists a little bit about the Kentucky Nurses Association and our priorities?
Certainly. First, of course, we want to thank everyone for spending part of their evening with us. We are excited and grateful to have you here. We hope the session is valuable for both you and the KNA members joining us today. As you know, nurses are represented in every legislative district across the state. So some of our constituents are here, and I believe it's the biggest night that we've had yet, and they're eager to hear from you all. Each year, the Kentucky Nurses Association works to improve not only nursing, but the overall healthcare within the state. We do this by volunteering, workforce data collection, the Nurse Emeritus Program, collaborating with other healthcare and professional associations, and setting forth legislative priorities for legislative sessions. These legislative priorities are based upon information review, sharing, evidence-based practice, and research-based policy. They are brought to the KNA's attention not only through these sources, but also through submissions from individuals, whether they are nurses, legislators, or private citizens. The KNA accepts proposals for legislative priorities or concerns year-round. To submit a proposal, you can find the form under the advocacy link on the KNA website. We greatly appreciate that the legislation for decriminalization of healthcare providers was passed this year. Kentucky is the first state to pioneer such legislation, and we are looking forward to seeing other states follow our lead. I was recently in Washington at the American Nurses Advocacy Institute, and everybody was talking about it, so I was very proud of Kentucky. Woohoo! In the 2023 legislative session, the General Assembly passed HB 176, Strengthening Policies to Prevent Workplace Violence. Data shows just how important this is. 48% of nurses have reported an increase in workplace violence, and over half of those nurses reported injury from that violence. It is a reality for our nurses. I was in the emergency room for 20 years, and I can tell you, it really affects nursing and patient care on a very substantial level. We applaud the General Assembly for increasing the safety of all healthcare providers within our great state and working to address the nursing shortage. As you know, Kentucky, as well as the entire US, has a critical nursing shortage of approximately 36%, or to give another perspective, it'll be about 13,000 nurses that we will be short by the year 2025. The KNA wants to continue to partner with the General Assembly to implement creative strategies to address these shortages. At this time, the KNA has 3 potential legislative initiatives for the 2025 session. While we won't have specific legislation at this time, our goal is to shine a light on, as well as educate and speak to legislators about these issues. First, the overall healthcare workforce shortage within the Commonwealth. Second, school nurses. And third, sexual assault nurse examiners, known as SANE nurses. You will find additional information on these topics in the town hall packet that you received. Please know that we will be sharing additional information in the near future on all of these priorities. The KNA supports a number of other issues dealing with recruitment and retention, nurse emeritus programs, making the workplace safer and less stressful, and measures that would make nursing a more appealing career. We work not just with legislators on our priorities, but with other provider associations and groups to collaborate on solutions. Now we'd like to give you all the opportunity to share your thoughts on issues important to Kentucky nurses. Our lobbyist, Julie Denton, and myself will be taking turns asking you questions, and Delanor will call on each participant. And I believe now you may have an unlimited time to answer the question. That is fabulous, because usually she's waving that red purple pin, whatever it is. So I'm glad that you're going to have plenty of time to communicate with this group on where you stand and how you can help us further legislation. So Julie, I'll have you go ahead
Linda,
and ask
if
the first question.
possible, we've been joined by another person, Vanessa Grossel. Did I say it right?
Great.
So
Yes,
Vanessa,
hi.
want to give you an opportunity to introduce yourself.
Vanessa Grossel. I'm running for the 88th House District, which is 29 precincts in Fayette County and 11 in Scott County. I am in this race because I want to make a difference. It's what I've been doing my entire life. I'm a former public school teacher. Then I worked in local government, started working in state policy as a policy analyst. Actually was looking back at a webinar that I did with the American Nurses Association during COVID around PPE shortages and other things like that that were of concern to the nurses at that time, just recently to prepare for this engagement. After I left my job as a policy analyst, I started working for the private sector, and I'm in education tech now. My mom is a school superintendent. She just retired on August 1st, and a big part of why I'm doing this right now is because I want to continue to live out her legacy and have impacts on families and children in our Commonwealth. I can stop there. I don't know how long you want me to ramble on, but happy to answer any questions.
All right. Thank you. All right, back to you, Linda.
All right, Julie, why don't you go ahead and ask our participants the first question?
We'd sent you all a list of questions with the background information on the things that Linda just covered, what our priorities are, where we've been, what we've been doing, and where we want to go. So that first question about the shortage of nurses, we threw in there to make you start thinking. We're not going to ask you to answer that question so y'all can quit sweating right now, because that's a really tough question. And we've got ideas on those sorts of things, and we know that we're going into a short session in 2025. So things that require money, those kinds of things, we may or may not be able to push those sorts of issues. But we just want you all to be thinking along those lines of the shortage. And maybe as you're reading publications, newspapers, listening to the news, when issues come up about nurses, you can kind of get your ears to prick up and think about, okay, what are they saying? And is this something we can do in Kentucky that we're not already doing? So that was just to get your brain juices flowing to be thinking in the nurse sphere. So we're going to go to the second question, which was about the sexual assault nurse examiners. And Linda was telling you there's a huge shortage. Sometimes, especially, well, most of the time, these are women who are getting these exams, and they may have to be driven a couple of hours away in order to get these exams. It's great. These exams are really good for the prosecutors because these nurses are collecting evidence for prosecution of the assailant. And so it's important that these are done. They take a long time, and the nurses are specially trained to deal with the psychological as well as the physical with these victims. And so this is something that KHA, the Hospital Association, as well as nurses, we all think this is important, and we're trying to find a solution. And it may include money, where we need to put some money forward to get some folks to be able to get the additional training, maybe to jumpstart getting a nurse in a particular hospital. So there may be some funding needs. And so our question to you is understanding the dire need for this and the shortage that we have, and that it may include asking the state for some money to help. Is this something you could support? And Kiana, let's start with you.
Awesome. So thank you so much. And I would love to start. I know that you said that first question was to kind of get us thinking. But I would love to start to kind of give you all a little bit of a background of why I'm excited to be here and appreciate nurses. So my day job, I get to work on the health sciences campus where I get to work with the schools of medicine, dentistry, nursing, and public health. And so when I went into health equity work, I had no idea. I was a history major, had no idea about health equity. I have a master's in human resources and organizational development. But I started my time looking at how do we develop the future workforce of health professionals? Specifically, how do we bridge kind of that gap and use and develop those pathway programs that are so essential? And for me, recruitment and retention, they go hand in hand. And so, as a legislator, something that I have the privilege of understanding and doing research and talking to colleagues in the School of Nursing and supporting nursing students is that oftentimes looking at it from an interprofessional lens, nurses spend the most amount of time with patients and are often the ones that are advocating the most for their patients, which makes them susceptible for injury and for the importance of those laws to protect nurses. So I'm coming to you all tonight with a basic level understanding, not understanding the clinical side, but just the overall broad kind of context of the struggle that is facing the field of nursing, and hoping that you all understand that you have a partner and someone who is on the ground helping to create those innovative solutions to address those shortages, both on the nursing side, but also we're experiencing primary health care shortages on the physician side, and really someone who understands the importance of interprofessional care as well. So I know that that wasn't one of those questions, but that's something that as I'm thinking through and listening to the needs tonight, that's something that's my day to day, in which I get to be on the staff side trying to support those folks that are called to the field of nursing so that they can stay in the field of nursing. So, speaking of staying to the School of Nursing to get to the same nurses, I have a very personal experience of why I am a firm believer in supporting funding and making sure that same nurses are provided for folks. Specifically, when I was an undergraduate student, I went to a small liberal arts college here in central Kentucky, and unfortunately, some of the statistics on sexual assault, specifically on college campuses, are astronomical. And so one of my close friends was assaulted, and a sane nurse was not there. We had to spend a lot of time convincing them even to report, right? Because that's another kind of barrier of folks that are scared to report when they have experienced sexual violence. I believe I was looking at the Kentucky Association of Sexual Assault programs, and what they said is that 39% of Kentucky women experience contact of sexual violence in their lifetime. That is 18% for men. And then 23% of Kentucky women will experience completed or attempted sexual assault. And so those statistics right there are alarming. And one of the reasons why it's so important for us to invest in making sure that we are mitigating violence when we can, specifically, health exists in all policies. And when we do not address the trauma that victims experience, that trauma often perpetuates itself within our system, within our society. And so I'm a big proponent of us investing in making sure that folks have the resources for healing, because after such a traumatic event, folks should have the opportunity to have holistic care to get past this massive trauma that they've experienced. So for me, it's important for us to invest in also allowing folks to understand the importance of sane nurses and how they can bridge the gap in terms of reporting, in terms of the mistrust that exists naturally within our system when it comes to reporting sexual violence, and also getting justice for those individuals that were assaulted. So it's kind of my thoughts on that.
Thank you. We appreciate that. Vanessa, would you like to go next?
I am happy to. I want to also touch on your first question about the nurse shortage. And just to quickly say, I think a lot of schools already have career pathways in high schools, particularly where they can start thinking about and even start down that road toward some sort of nursing degree. But that is something that I think is essential to encourage our young people to go down that path to help fill those gaps. Regarding SANES in Kentucky, I know that there are two critical federal funding programs that Kentucky is eligible for, and I would hope to leverage those funds. I'm talking about Victims of Crime Act funding and the Violence Against Women Act funding. When I worked for the city of Lexington, I was on the Prevent Domestic Violence Board, and we realized during that time, it was under Mayor Jim Gray's administration, that we had a large backlog even of the rape kits that had been performed by the SANES. And so I don't know exactly where we are on that to date in Central Kentucky or in Kentucky as a whole, but I would be really interested in looking into this issue. And I'm sure some communities are doing better than others. Our rural communities always struggle. I would love to find ways to fill those gaps and ensure that justice is being served and that we are getting funding out so that communities can have those sane nurses, especially if we can leverage federal grant programs.
Great, thank you. Is Representative Pfister still on? Because I'm not seeing him, but I don't trust my technology.
It looks like we lost him, Julie. We'll see if we can find him, okay?
Okay, that's fine. We'll move on to question number 3, which Linda, take it away.
Certainly. So question number 3, what are your thoughts regarding a full-time nurse in every school? And do you support funding assistance from the state back to school districts to help cover the cost? So Vanessa, you just finished. So Kiana Fields.
So one of there are a couple of challenges facing kind of healthcare in Kentucky. One is access to healthcare. So oftentimes we see children don't always have access, whether parents can't take them to the doctor, whether there's a lot of barriers to care that exists that prevents certain populations of students of getting access to healthcare. And so that's a factor that having a full-time school nurse can help address. We also look at, when students have access to healthcare earlier on in their time, you not only get to address potential signs of child abuse, but you also help to build different components in terms of health education and health literacy. What we see in Kentucky is that we rank 41st in overall healthcare. And so when you give students the opportunity to get healthcare early on, them learning how to describe what their symptoms are, them learning kind of different ways and what health looks like early on, that is one way that we can start chipping away at some of those health disparities that we see within populations, specifically for students. We have a lot of gaps that exist, and this is one of those, this is just one component that can help. It's multifactorial in terms of helping to improve overall child health care, but allowing for full-time nurses to be in place allows us to address different issues, including child welfare, including different things that might fall between the cracks.
Very nice. Thank you. And Vanessa.
Thank you. Yes, this is something I'm pretty passionate about, having been a teacher. And, I taught for 4 years in Fayette County at an elementary school, Wellington Elementary, but I also spent 5 years living in Georgetown, Kentucky's sister city in Japan. And so in Japan, the school nurses were really a core part of the education team. I think having school nurses in every school could really help us think about becoming healthier Kentuckians in a more robust way. And so, yes, to everything Kiana said about access to care, I believe that right now in some remote parts of the state, we have nurses that are acting as liaisons to telehealth, to physicians, to actually prescribing medicine, all sorts of things like that. I love that because
not only are we getting these kids and families the care they need, but it also creates a situation where there's less absenteeism, right? The parent doesn't have to pick them up and have them gone for a half day, full day. It also means parents aren't having to take off work to take their kids in all these situations, right? But I do see, I mean, and I saw this in Japan. Nurses were the foundation for talking to kids about healthy eating, about, you know, how much sugar is in that glass of orange juice or that soda that you're putting into your body. I think there's so much potential there for the little ones to learn about healthy eating, and even perhaps birth through 5 before the unhealthy eating habits really start. If we could, you know, depending on the bandwidth, I know nurses are often, you know, short-staffed and underserved, but I see nurses as a key in working with school counselors for suicide prevention as kids age, as liaisons for drug awareness and drug prevention education, and working in partnership with the school resource officers to identify potential students with mental health issues. And so I would be in favor of it. I think there must certainly be ways to fund it. And I think that it should be key given all of the mental health focus and everything else that our state is dealing with at this present time.
Thank you. Julie, go ahead. Question number 4.
So the school nurses and the SANE and the workforce shortage that we've got, the nursing shortage that we've got, we just wanted to give, and this is probably not even necessary now because we haven't limited you on what you're having to say. And we had about a half dozen other people who were supposed to be on tonight that we're not quite sure where they are. And I was texting everybody who didn't show up, trying to remind people that you RSVP'd. Are you still coming? So in the event that there's something else you guys would like to add with regard to the nursing shortage, school nurses, or SANE, I'll just give you guys a quick, does anybody, either one of you have anything you want to say on that additionally?
Adam
Adam's
Moore.
on. Great. Adam, welcome. We have been talking about school nurses and the sexual assault nurse examiners, and there's the shortage of the SANE nurses, the sexual assault nurse examiners. There's a shortage of those, and we may need money for those from the state to help them get educated and jumpstart the hospitals who don't have them. And then we really want a nurse all day, every day in every school. And then we didn't really get into the first question so much as just talk about it a little bit about the shortage of nurses. And so now that you've joined us, the fourth question is, does anybody have anything else to say about it? And so now's your opportunity to say something on all of it.
Except that he needs to introduce himself.
Oh, that's right. You do. Sorry.
Thank you all for letting me hop in here. My name is Adam Moore. I'm running in the 45th House District. I'm actually in my district right now. We had one of our community members had a little event this evening. That is Southwest Lexington, Kentucky. Excited to get a chance to represent it. As far as this and your all's event and the issues that are important to the nurses and the questions you just brought up, the nursing shortage, the SANEs, and then also having a nurse in every school, I kind of feel like that they are all intertwined, like they are not separate issues. Like I think the first thing we have to do is, of course, promote that we address the nurses shortage. Now, whether that is through some type of, like historically, there have been options for loan repayment, those who go into critical programs that are necessary but are unmet. So I'm wondering if there's options for loan repayment options for those going through nursing programs right now here in Kentucky. If we can have options for underserved areas, whether they are inner city areas or whether they are rural areas, if there are financial incentives to get nurses into those areas as well. And then as far as like the SANE nurses, SANE nurses, similar ideas, is there a way to offer either a financial incentive for those who are already nurses to step into those positions, whether that means their training gets with extra stipends or stuff with that as well? And then as far as nurses in schools, I'm a big proponent of our public schools and that we are obligated by our state constitution to provide a good place of learning, a safe place of learning for every student here in Kentucky. And so if it's going to be a safe space, we need there to be nurses there as well to keep our students healthy and to keep them in an environment where they can learn properly in our public schools. So I absolutely think that the state government has an obligation to have that nurse there in our public schools. But I say it all, it's interconnected because we need to meet that nurse shortage first. And then maybe we can have incentives to create, once we have enough nurses, to matriculate them into the SANE program or into SANE positions or qualified positions and into our school nurse programs as well.
Great. Thank you very much. Vanessa, do you have anything else you want to add?
Yes, I had 3 points and can only think of 2 at the moment, but one of them, I grew up in Eastern Kentucky. I appreciate what Adam just shared about the rural-urban divide. That's huge in our Commonwealth. My family was personally touched by the opioid crisis. I lost my father actually about a decade ago, and so that's something that's near and dear to me and my heart, and I think that in particular, the school nurses and having the proper nursing workforce could help alleviate some of that and provide the proper care to those individuals before they go down that path toward, no return. And so, growing up in Eastern Kentucky, it's funny, all of the physicians I saw as a kid were from India, right? And so I remember someone read a book to me when I was in the classroom when I was an elementary school kid, and it was addressing the issue of like diversity in race and ethnicity. And when the teacher said, "What's different between these people and us?" One of the kids in my class actually said, "They're all doctors and we're not." And
Whoops.
so, just lovely, like, fun way to look at those issues from like the flip side. That was my experience growing up. I feel like I am a person who feels very strongly about being tough on border security, but at the same time, I have lived, worked, and traveled in over 60 countries, and I absolutely believe in visa programs to help us with our nursing shortages. And the other thing, I'm just now thinking of it, the third piece that I was going to say is about compacts, state to state. And you all probably know quite a bit about these. I think there's a nursing compact already in place, emergency managers compact, physical therapists, others like that. But essentially, for families who may be military families who move around a lot, if you are licensed as a nurse in another state, I want you to be able to work in Kentucky as a nurse. And that's really important in our border communities with West Virginia and Indiana and Tennessee and everywhere else we border. So I would be supportive of more compacts along those lines. I'm not super familiar with the compact that exists and if it's only for RNs or if it's for other levels of nursing as well. But the more we can do like that to grow our healthcare professionals from within our own country, that's fantastic. I also do think we need to start looking abroad and maybe bringing in some healthcare professionals on some of those special immigrant visas that we used to use back in the day. And I don't know if people are just not using those as much anymore or, what's going on with those federal programs. But I would be in favor of educating folks on how they can leverage those in our state.
Great. Kiana?
So, I am a firm believer that we have incredible opportunities here in Kentucky. And, being able to look at and have worked in building the pre-health pipeline has been something that has been a great joy. And oftentimes, specifically folks that have never really experienced or thought about different career professionals, them kind of breaking down what that pathway looks like is super important, specifically for first generation students. So for me, I think that I could go on and on about what I think, but that's not helpful. For me, I want to ask you all questions. I want to know what have been the barriers to passing some of this legislation? I want to know, where do you all see the field going from your perspective? Because you all are the experts in what's happening on the clinical side. And so for me as a legislator, I would rather spend this time, instead of saying and thinking and grappling at straws, I want to be intentional, because addressing shortages, addressing the health disparities, addressing creating an environment that nurses feel like they are valued and equal and well compensated is super important to me. So my cousin just graduated from nursing school, and that was something that we spent quite a bit of time of, which program is best for him, which program does he want to stay in, and it took almost 6 years for him to land on a program. And after he graduated with his RN degree, he ended up leaving the state of Kentucky. And part of the reason why he left the state of Kentucky was because just over the river in Ohio, they have higher salaries. And so even when we are developing talent and nurses here in the state of Kentucky, we're often losing them. And so for me, I want to hear from you all so that when it comes to supporting the policies, I can have you all at the center of that advocacy. That for me is the most important part for this question.
Well, that was quite lovely. And what what I want to say is I'm going to ask our president to talk a little bit about our nurse legislator engagement program, and I think it will help in terms of you having resources. But before we start on that, I just wanted to mention a couple of facts, and that is, as we talked about the SANES, and everyone said that they would be willing to support financials, money, so that we could have more SANE nurses. I just want you to know that I think we have close to 4.5 million people in the state of Kentucky. We have 359 SANE nurses for the entire state. And you heard Julie mention about, in many cases, people have to travel long distances to be seen by a SANE. Most of our hospitals, all of our hospitals have people who can do exams, but they are not SANE nurse trained, which means the people who are being examined are not getting the same quality of that exam and emotional support. So that's one thing. And I also wanted to mention about, let's see, what was the other thing I wanted to mention? I got carried away on SANES. Legislators and immigrants. I think it was Vanessa who spoke about bringing in other people to the United States to help us with our shortage. It is a great idea. And we are very interested. And in fact, Julie has been working with a legislator who wants to support military people who have served and to help them to become nurses as well. The KNA is really committed to supporting that, but along with that support they have to be qualified. You know, one of the things that happened with one of our Senate bills in our legislators' efforts to help us with the nursing shortage was they wanted to bring in nurses from other countries, and they didn't have to take the NCLEX exam. Well, NCLEX is basic. That's a beginning point. Everybody must pass that. If you cannot pass that, you cannot practice. And so, but I'm not sure they even knew that in terms of the NCLEX being so basic. And so that kind of leads us to the program that Dolores is going to talk about, and that is our nurse legislator engagement program. Dolores?
Thank you, Delano. That was a perfect segue. It really was. So in many efforts that we're doing, as Delano outlined a couple of them, there's one other one that we are doing to support legislators who are making decisions for healthcare issues as well as the nursing profession. And the one Delano mentioned is a perfect example. As they were working on this bill to help with workforce issues, if we collaborated and served as a resource, we could have made them aware of the need of inclusion of NCLEX because that's entry-level competency. But our program that we have implemented that we're very excited about is our nurse legislator engagement program. And that is where we are pairing our KNA members with our goal is all 138 state legislators. Right now we have members paired with 86, so we are moving along and getting close. And we will get to that 138, just takes a little bit of time. And it really is wonderful. The legislators that are paired are sharing feedback with us that they truly appreciate being able to build a relationship with that nurse. And that nurse that's paired with them serves as their liaison, is sharing their nursing expertise, knowledge, and experience with them. When we as the KNA, we are sharing information with legislators and others across the state, that nurse paired with the legislator can share that information with them. And then that legislator can reach out to that person anytime that they're working on something and they have questions about, because we know that a lot of legislators do not have a healthcare background. So we want to serve as that resource and assist in them and providing the information they need to make the decisions that they're doing. So a lot of great feedback.
That's fantastic. I'm relieved to hear that. And I appreciate Kiana for asking that. And just, I'm going to need to lean heavily on you all for sure on healthcare
Yeah.
related topics. I already know.
Wonderful. We are here.
We are here.
Yeah.
So Dolores, you want to close us out?
I will. Thank you again to everyone for being here tonight. We truly appreciate you all taking time out of your evening to spend with us. And a special thank you for understanding technology issues. Technology is our friend, but not always the friendliest. So we appreciate that. We really did have a lot of great discussion, and we appreciate our panelists sharing your backgrounds and your thoughts on the issues. We truly appreciate that support. I would like to share just a couple of announcements with you and upcoming dates of events. September 26th, next Thursday, it's our annual business meeting, and it is where we'll have our year in review of a lot of our activities and initiatives for the nursing profession and promotion of quality healthcare in Kentucky that we have accomplished across the state. It will be a review of our strategic plan and meeting those goals. We'll have a Nightingale tribute or legacy program to honor our nurses that have passed in the last year. We'll be voting on bylaws changes and much more. But please try to attend that. It's virtual at 5 o'clock. And then on November 7th, up in Northern Kentucky at Turfway, we will be holding our first gala to celebrate nurses. It is going to be a fun evening of networking, dinner, dancing, an awards ceremony. It's truly going to be amazing. We hope everyone can attend that. And then the very next day, we're going to stay the night in Northern Kentucky because the next day is our annual conference. And the theme this year is Inspiring Action, Transforming Care, Nurses Lead the Way. The keynote speaker is Diana Mason, and if you're familiar with her, she is the author of our healthcare policy book that just about every nursing school in the state, country, probably globally, I'm pretty sure it's out there, is going to be our keynote. So it's going to be amazing, as well as the rest of the agenda with our other speakers that will be there through the day. So I hope you can attend. That will be in Northern Kentucky as well at St. E's Training Center. So again, we want to thank everyone for being here tonight, participants, as well, again, the panelists. We truly appreciate you being here for our town hall, and we hope you all have a wonderful rest of your evening.